Hi, it's Trainer Lori. I'm back for day 3 of my therapy, my day 3 of my comeback. So today I went downstairs and there were a lot of people in the therapy center. I had not seen a lot of people before. So one of the things that I noticed is that a lot of the people are older than me, which can be very devastating. My mother was 90 when she had her stroke, and it affected half of her brain, and she never recovered. She died 6 months later. But also, there can be people who are younger than me, a lot younger than me. There's one gal who is probably in her early 20s, and it's more sad to see that because I've had a long, full life, and this is her life right now. We don't know what it's going to be, so it's a lot harder, and I think it's more devastating. But anytime you can't do what you want, no matter what age, can be very frustrating. And for me today, the frustration was using muscles that I didn't want to use because they hurt. Now here's a little background. I have an issue with my hip, and I've been having that for a couple of years. It's actually something I probably had ever since I was born. But one leg is shorter than the other one, and my pelvis has a tendency to go out instead of in. So as a result, if I don't hold myself up straight, then my muscles atrophy. My adductor leg muscle on my left side and my gluteus maximus have both atrophied a little bit. And because I'm going through all this physical therapy, they're finding this out. I knew about the adductor, I did not know about my glutes. And so they're giving me additional strength training for those, which hurts. But on the other hand, no pain, no gain, right? So you have to do a little of that painful things so eventually it gets better. In fact, that's exactly what happened to me when I had the big stroke. Now remember, I had multiple little strokes while I was in the hospital, and as a result, they were able to test, but they really couldn't see what was happening because it wasn't leaving any evidence yet. It wasn't that big. I had been talking to my son on the phone, and I just hung up, so it was about 9:30 at night, and all of a sudden I could feel that same burning sensation. The burning would be on the right, I guess, but I felt it on the left going all over my body. It was much worse than any of the others. It was all-encompassing. And I knew as I laid there, this is it, this is the big stroke. But it was also late at night, and while the little ones were happening, they couldn't do anything, so I thought, I'm just going to wait until it's done before I tell anybody. Then I fell asleep. Fortunately, the nurse came in at 11 to give me some meds. And when she did, I took the meds. I had some difficulty, but sometimes you're not cognizant of what's wrong. Then I decided I needed to use the bathroom. So I got up, but I couldn't walk. I didn't think, oh, there's something wrong. I just thought I need to walk differently so I can actually do it. So I was like walking like a gorilla. If you've ever seen a gorilla with their legs widespread and their arms out for balance. And it might be not a gorilla, maybe it's some other big, one of the great apes, but nevertheless, that's what I was thinking when I was going to the bathroom. Oh, this is interesting. I need to walk like a gorilla to go in here. When I was in there, I couldn't pull my pants up, because my hand wasn't working, and I thought, oh, there's something wrong. The gorilla walk didn't tell me something was wrong. It was the fact that I couldn't use my hand. So anyway, I made it back to the bed, and I thought, should I tell somebody or shouldn't I? And thank God I had this little insight that said, if you have a stroke, you need to tell them immediately because there's a small window of opportunity to fix it. So I looked around on my bed and I found the nurse button and I pushed it. As soon as I pushed it, I told her, I said, I've had the stroke. I said, I'm numb. She sent out an alarm, and apparently, because I heard later ones over the loudspeaker, and I guarantee there were a dozen doctors standing around my bed within 5 minutes. A dozen doctors, and they had every kind of equipment, and they were doing EKGs, and now they knew that it probably wasn't a heart attack, but a stroke. They weren't guaranteed what it was, but there is a treatment that they can give you within 4 hours. Now, had been 3 hours. That they can give you within 4 hours with the stroke that will prevent you from dying, having another stroke, having all kinds of other issues because your body becomes paralyzed. So they all met together, including they took me to this room for diagnosis, and there was a woman who apparently was a world famous specialist in this kind of thing that they wanted to talk to, all of the local 11 o'clock doctors. And she told me that it looks like a stroke and that I would benefit from a treatment called TPA. I should probably look that up and tell you what it stands for. But essentially what it is a very, it's a blood thinner that is extremely dangerous. Okay, I looked it up. It's tissue plasminogen activator, TPA. And what it does is it thins out the blood super thin, so it's very dangerous. In fact, one of the things she said, in fact, the very last thing she said to me was, there is a 7% chance of death if you take this. Now remember, this is 11 o'clock at night. I wasn't thinking really clearly anyway. And I thought, well, what should I do? This sounds pretty dangerous, you know. That it certainly was one of the highest risk questions I've ever been asked. So I looked at the first doctor and I said, should I do it? And he said, I can't answer that. So I thought, let's try a different kind of question. So I said, has anybody had experience with TPA? And one doctor raised his hand. And I said, do you think it's worth the risk? And he said, I do. I said, all right, I'll do it. So you know what? Nobody really has to be ready to answer that question until it's a life or death situation, but it's something you might want to think about. You know, how much risk am I willing to take for the reward? And I wasn't even sure what it was going to do for me, but I'm glad I did it. I have to say, I'm very glad I did it. As a result, they had to put me in ICU, neuro ICU. It's just for people with neuro issues, neurology. And that means I was being constantly monitored. I had a tree of fluids and electronic devices attached to me. That's why my arms were so beat up. And I had another thing on this arm for other kinds of liquids, like other medications and such. So I was watched for 24 hours. They called it at midnight. They called it that they had me. It was actually a little earlier than midnight, but they needed 24 hours that I'd have to be watched. And hopefully everything will turn out okay. Well, it did. I didn't have another stroke, or they call it, they have another name for it, a cardiovascular accident, CVA. They don't call it stroke in the hospital. But I didn't have another one, and the good news is that if there were other things in there blocking, it might thin it out enough so that it would just be passed through my bloodstream. I don't know if there was anything more in there. After they took the test, they could see where the blood stoppage was, but they didn't take another one after that because it doesn't matter. Like the doctor said, the original one, those cells were dead. So all we're working for now is a workaround. In the meantime, whatever's in there will be absorbed by my brain or dissolved and flushed through my body. So that's the goal. Because once you have a stroke, you have a very high risk of having another one. As a result, they've put me on all kinds of meds. I have finally written them down because there's 5 new meds that I've never taken before. Some of them you've heard of before, like Plavix and Lipitor, but then some other ones I've never heard of. Aspirin, of course, but I was already on aspirin, and that was one of the things they said helped. So I can't even imagine what it would have been like if I hadn't been on aspirin therapy. The reason I went on aspirin therapy was because I used to travel all the time. I was in airplanes. And when you're flying high, you have a chance of getting deep vein thrombosis, which are blood clots in the leg. And so I took aspirin to keep that from happening, and since I had been on it, I just stayed on it. Because I was on aspirin when I got a stroke, that's not good. That means there's a lot of other issues going on, and that's why they wanted to give me other meds as well. So keep that in mind. Not everybody's the same. Remember, mine was actually kind of light, I think, in comparison to what I'm seeing. For example, I can walk, and I was able to walk pretty well, pretty early. I needed a walker at first, but that was just to really get off the bed. Now I don't need anything to get up, and I don't even need a stick to walk. I just feel more comfortable with a stick just in case my hip starts to feel like it's going to give out. I don't want to fall. That's the last thing I want to do. In fact, a nurse told me that there was a man who was, I can do it myself, because they really want you to call them for any kind of assistance. I don't want to. I want to do it myself, right? Well, this guy did it, and he got up and he went right on his face and got a really bad head injury. And who knows what happened to him then. I don't want to go there. I do not want that to happen. I'm pretty cautious. I want to take care of myself. So that's really what happened in the hospital. I just wanted to kind of give you that background without having it all at once. But now I'm in therapy, and I want to show you one of the things that they asked me to do, which is very useful because on my list, where's my... Well, I was looking for my putty so I could show you the work that I've been doing. I've got a new, I've misplaced it. It's not here at all. So either somebody came in and said, oh, that looks like fun, I'm going to take it and play with it, or I've put it somewhere that I can't recall. But anyway, one of the things that I'm doing is squeezing it through with my fingers. And because my goal, they always ask, what's your goal? Everybody has a different goal. One guy says, I want to go home. I want to be able to live at home by myself. And right now it looks like he's going to have to go to a nursing home first, so he's not ready for that goal yet. My goal is to go back to work because I love my job. I love training. I love creating training. And to do that, I need to use a computer. And that means I need to use the keyboard. And right now, this little hand is too wonky. It can move the fingers in the right direction, but it can't feel where the keys are, so I'm off. And so I've been practicing with that. That's one of the things. So they had me practicing squeezing with each of my fingers separately so that they get feeling back. They understand that my thalamus says, oh, so that's where your finger is. It's right here. Okay, I can feel that. So that's an important thing, that it touches something else so it can regain that spatial relationship. And I opened up a Word doc and I just started typing, and while the OT, the occupational therapists, those are the ones that help me do things that I would normally do in life, not just for a job, but anything like brushing your teeth, whatever. They watched and they said, okay, you're going too fast. And this is a gal who doesn't type. This is the OT isn't a typist. She's from Cuba. And she's been trained on how to do this kind of therapy, but she doesn't actually use the computer. So she said, you're going too fast. She said, you're normally a fast typist, aren't you? I said, yeah. She said, well, this hand needs to catch up. It's not there yet. She said, go slow and look at your fingers. Now, those of you who've ever been taught typing by someone else knows you never look at your fingers. Same with piano. You're not supposed to look at the fingers. You're supposed to do it by feel. But since I have no feel, I have to look. Just like when I tried to put my hair up. This time it's a little different. Every day you're going to see it, it's going to be a little bit different because this hand can't feel anything. If I don't use the mirror, you don't want to see it. It'll be like one-sided or something because I can't tell what's happening. So now I go slow and it actually would type out a word. I go slow and I look at my keys and it actually worked. It's very frustrating because I like typing fast without having to think, of course. We like to do everything we're used to doing. But I also, knowing that this is my job and I can't just be a slow typist, I tried my speech to text in Word. It works. It's really good. So it recognized. Remember a few years ago, it wasn't very good. You had to train your computer to understand the way you talked. Well, this one picked it up immediately, so I'm very excited about that. Going slow, knowing that I still have a little speech impediment from although everybody says I don't, but to me, because I have to work hard to enunciate, it still feels like a speech impediment. So anyway, that's where I am. I'm doing a lot of exercises for my glutes and my adductor, which really hurt. The other ones don't hurt, they're just tiring because I'm using my body in ways that I haven't used for a couple of weeks. But probably the funnest one was it looked like one of those little things that you jump on, trampoline, a little mini trampoline, but it wasn't to jump on. I said, oh good, we get to jump. Knowing I would not do that. I would fall. I know I would fall. But you actually throw a ball at it, and it comes right back to you. So that was fun, to be able to throw the ball and actually catch it, and to be able to gauge it right so that it would come right back at you. So it's fun to do those, and it's not fun to do some of them, like the stretching and the repetitious ones that hurt. Like she had 5 rings on the floor, and I had to stand on my wonky leg and tap my toe into each of the 5 rings, which is fun. You know, it looked like the Olympics. I was a very tiny little Olympian today. So it's fun to try some new things like that. But it's also hard, I have to tell you. Things that would be super easy for me 2 weeks ago are not easy today. And I was hearing other people, since it was a full session, that they were saying, I don't want to, I don't feel like I can do it. And so the therapist said, do you not think you can do it, or are you just afraid you can't do it? And she said, no, and I think I know what she was feeling, because I don't feel like I can trust my leg to hold me. It's not like I don't think I can do it. I know I can do it. I just don't trust that I'm not going to fall. And so I feel more comfortable holding on to something. And I think that's smart to notice that and be aware of it, so that you don't be like the guy that fell right out of bed because he wanted to do it all himself. So my advice to you, based on my 3rd day of training, is to really listen to your body, understand it, but also know that your brain is what determines what you can do. And if you have positive feelings about it, if you really want to do it, you can. I used to have a really good quote about that. Oh, I know what it was. It's Henry Ford. He said, if you think you can, you can. If you think you can't, you can't. Something like that. I'm sure I paraphrased it, but the point is if you think you can do it, you can do it. So that's where I'm staying today. If I think I can do it, I can do it. So I'm going to think it. And I hope you can do it too. Thanks. See ya.